Welcome to the Executive Function for All podcast. Today we're joined by Dr. Jennifer Paz Ryan, a clinical psychologist and co-founder of Elevated Insights Assessment in Denver, Colorado. Jen specializes in students with complex and overlapping challenges. In this episode, we'll explore what happens when conditions like ADHD, anxiety, autism, and learning disabilities show up together, how they mask each other, and why getting the full picture through an assessment can be a turning point for a student and for a family. I love Jen's passion and her insights in this one. Thank you so much for joining us, and let's begin. Jen, thank you so much for joining me today.
Thanks for having me.
You are one of my go-tos for students with more complex learning styles, right? Yeah. Students who just learn differently. So I want to start with, what is a co-occurring condition?
A co-occurring condition is when there are two or more potential diagnoses or things that are impacting somebody's functioning. So a co-occurring condition can be like anxiety or ADHD. It can be depression and anxiety. It can be ADHD and autism. And, right, they can be all of them. It can be a learning disorder with ADHD, a learning disorder with ADHD and anxiety. And we also know that a lot of times neurodivergent individuals are more prone to having co-occurring conditions such as anxiety and depression because consistent feedback, right? A lot of times it's the negative feedback that starts to impact self-worth or self-confidence and self-esteem. And so co-occurring conditions are those that exist at the same time.
Well, a question I get all the time is, are these becoming more common, or are we just getting much better at identifying them? So I got an ADHD diagnosis growing up, and then coming here, we rarely see students with just ADHD. It's always ADHD and. So what's going on there?
I don't know, actually. That's a really good question. I think chicken or the egg, were they always there, and people just didn't dig a little bit? Because I think that's the thing about co-occurring conditions, right? Is that there's a lot of masking that goes on and a lot of misattributing the characteristics. So let's say that, anxiety and ADHD, for example, a lot of times anxiety can mask the ADHD, or the ADHD can mask the anxiety. So the important piece is figuring out kind of that foundation of where is it coming from in order to be able to understand and then treat it. Because anxiety can impact your attentional control. It can increase distractibility. It can lead you to be more hesitant or reluctant to participate. ADHD can do that too, in terms of cause distractibility, have trouble focusing, concentrating. They can look alike, but depending on how they present or where they're presenting, they can overshadow each other. They can mask each other. I think in terms of the growth of that or the recognizing, I think it's more the detectability of we're realizing that these things do exist and that they are not necessarily siloed.
Interesting. How on earth do you begin to untangle those?
A comprehensive evaluation. I think this is why the evaluation process is so important, because, anybody can kind of look at the diagnostic criteria and kind of throw out like, oh yes, do they have this trait? Do they have this characteristic? This and this. So then that must mean that they are anxious, or they have anxiety, or that must mean that they have ADHD. But I think that's where you have to go in and get a better understanding, a bigger picture by those in-person standardized assessments, where we can actually start to tease out what is causing what, right? What's the driving factor behind the anxiety, or what's the driving factor behind the gaps in attention? Is it anxiety based, or is it actually a part of the executive functioning, right? Or that attentional control? And I think that we listen. I think that's the important thing too, right? Is listening. So the parents, the child, teachers, the people who interact with them the most are also really good people to be thinking and talking to about what they notice and when they see it, and then the individual's experience too. I mean, kiddos as young as 5 can tell you about what it's like to be them, right? Where things are hard. I had a 3-year-old yesterday who we were doing some memory and learning, and super, super bright 3-year-old. And we got to a point where we were reading story. I was reading a little story and asked him questions, and it was really challenging, and he kind of shut down and he told me, I don't like those stories, right? Like a 3-year-old can tell me what it's like for them. And so I think that's why it's so important to not just go based on, what you see, but also like that inner world, that inner experience of a child is so important.
Yeah. And I feel like that's a lot of what these quick evaluations that people do kind of miss. They don't get the full picture from all the different sides and all the anecdotal stories like you're talking about. For families or educators who've heard about a comprehensive assessment, but don't know exactly what that means. Mm-hmm. So it sounds like there's an interview portion. What else is involved in a comprehensive assessment?
I love that question. So many people are kind of hanging up their shingles and saying like, we do comprehensive assessments. And yet like when you look at them or, they're not actually as comprehensive as you would hope them to be. For us at Elevated Insights, it starts with the intake. It starts with, what are your concerns, right? When did this start? What's the developmental history like, right? What does it look like for you now? What have you done? What has worked? What doesn't work, right? Again, we're talking to individuals who interact with this child or student on a regular basis and checking in with the child. But also the assessment process depends on what's the question, right? So for ADHD, a comprehensive assessment is much more than some parent report forms and a little test of computerized attention, right? It's so much more. We want to look at the executive functioning. We want to look at flexibility, initiation. What happens when we ask the kiddo to shift? What happens if it's visual versus verbal, right? Like how are they shifting? How are they recognizing? How are they problem solving, right? We want to see all of that in action because that really tells us about somebody's executive functioning and how they're organizing, how they're solving problems. So I think really understanding what is the testing battery that is going to be done and how is that different maybe from different places that you're calling around to finding out like what is considered comprehensive for that organization.
I know, especially in your practice, everyone gets a different series of assessments based on the challenges they're going through, right? But how long does this process usually take when done well?
Ooh, it depends, right? Because again, when we go back to co-occurring conditions, if we're trying to tease out like multiple things, let's say learning disorders and ADHD, because we know that if you have a learning disorder, the co-occurrence of ADHD is actually much higher. So we're looking at a ton of things like, right, learning, reading, writing, math, all of these things are really important. And that can take a long time. So I would say if, it can range anywhere from 3 to potentially 8 hours, depending on the standard battery and what it is that you're looking for. It also depends on the kiddo, right? So, right, we have a lot of kiddos that really they're the drivers and we're asking them to do a lot of things. And so that might mean that we have a lot of breaks. It also might mean that they tap out and that's okay. And we have to reschedule to do the rest of the evaluation, right? Like it really is about that kiddo's stamina and we're asking them again to do a lot of cognitive effort. And so we want them to be able to be the driver and we want their effort to be the best. And so we also have to read the room and read them and figure out like, do you want to keep going or do you think it's better to take a break and come back and do it another day? And there's no right or wrong.
I know it's so dependent, but I wanted to get that out there, how intensive it can be, because again, I'm a former school psychologist. So this is nothing against the education system, but families would go to their school and think that they got a comprehensive assessment. And I would work them I do 15, 20 minutes of assessment. Sure. And they're like, we already have that. So I just wanted to make sure I got out there, like what an actual comprehensive assessment looks like.
Yeah. I just piggybacking on that, more and more schools now have stopped doing cognitive testing, which is so interesting. And I know that came out of a lot of parts of California of saying, individuals that are Black and brown are much more identified with having like an intellectual disability because a lot of the tests that we're giving aren't necessarily normed on their specific population. And I think that's the other piece of making sure that wherever you're going, you are working with an organization that is very attuned, culturally responsive, linguistically responsive, understands the limitations of some of these tests, and yet still can speak to the importance of utilizing these tests when we're measuring against same-aged peers, right? And I think that's the other piece of the comprehensive assessment that's so important, is that nobody should ever be using one piece of data to be making any kind of diagnosis or assumption, right? That's the other piece. That's the beauty of the comprehensive assessment, is that we're taking pieces of all data, like all these data points, right? Parents, teachers, students, then we're taking the actual assessment data, we're taking our observations. There's a lot of pieces that we're using and trying to synthesize and put together that understanding, that whole child comprehensive understanding, versus relying on only one piece of data, which is very dangerous.
And that's really the core of what we're talking about, versus, I know how I grew up. The doctor's like, you having trouble focusing? I'm like, yeah. And they're like, ADHD, right? Like that's the core of what I think you and I really want to express to families, is that if you find someone who really knows what they're doing, they are not looking at one data point. They're looking at this big picture.
Absolutely. And I think that's the other thing, right? Is I've been thinking about this because a lot of pediatricians, a lot of people rely on their pediatricians to support them understanding more or identifying areas. And again, pediatricians are doing the best that they can, most of them, right?
Of course, yeah.
And they've got these Vanderbilts that they send a lot of times, and based on a parent's rating or based on a teacher's rating or the child's rating, they'll diagnose ADHD, which can be helpful, right, in order to kind of figure out what's going on, but it misses how the brain is actually working, which is what we can see in a comprehensive eval. So even if they do end up meeting criteria for ADHD, a comprehensive eval is going to help explain how the brain is working. How is it processing? How is it solving problems? What's it missing, right? Are they prone to errors? And what can we do about that versus just the ADHD diagnosis when we really don't know what that looks like because it's so unique for everybody.
Yeah. You and I work with a lot of pediatricians. Obviously, we're educators at heart and we're all doing the best we can. It's just a very different ability to dive in. So if you do have that ADHD diagnosis and things still don't feel right, we both recommend the comprehensive evaluation.
Absolutely, especially when we think about kiddos who are going through the education system where supports naturally decrease, right? There's a lot of teacher and adult support in the early elementary school ages, right? And then all of a sudden, we start to push kids to be more independent, right? So I was a elementary school teacher and I trained in special ed too. The jump from third to fourth grade is insane. We quit teaching the kids how to read and now we're asking them to read to learn. So even that transition is really hard. And then middle school, right? So we go from, we've got a lot of this scaffolding, we've got a lot of teachers reminding and everything. Then we jump to middle school where there's even less of that. And so even if a child has an ADHD diagnosis, their needs might change and evolve. And so what they look like at the third grade is not what they're looking like at the sixth grade. And so we might need to intervene differently or change the accommodations in order to better fit that kiddo.
Got it. You already touched on this, but once a student gets a comprehensive assessment, how does that change the picture of what the family views as possible?
So I think it changes everything. And the best feedbacks are when there's this moment and the family and the child, right, if they're participating in the feedback, which is totally dependent, again, they're the driver, understands the differences that are really relevant and prevalent for their kiddo, but also understands the strengths, right? And I think that this is where an assessment can be so important because a lot of times parents come or kiddos come and there's already been these labels of like they're lazy, they're manipulative, they don't listen, right? They're dramatic. And I don't know about you, but when I hear those, it doesn't really give me a favorable picture of my child. It doesn't make me feel good as a parent. It definitely probably doesn't make the kid feel good. And so I always think about everybody wants to be successful. No kid says, let me wake up and fail. And I think having an understanding of what might be going on, even if it's never a diagnosis, let's just say it's just slower processing. For a family and a person to understand that it's not that they're slow, it's not that they're dumb, it's not that anything is wrong with them, it's just that they're processing at a different rate and they might need some more time or they might need something repeated. Isn't that so much more just affirming than to think something's wrong with you versus no, my brain is wired to just need a little more time. I feel like it changes the entire perspective, right? And I also think that it allows advocacy and agency. So when a child, I've actually seen a lot of kiddos more recently be the ones initiating the evaluation. So their parents are coming, they're filling out the forms. They're like, actually, my kiddo was the one that wanted this eval. And I think that's amazing. It's a total change in a shift right now where the kids are coming with their own curiosity and the parents are being supportive and hearing something's not clicking for their kiddo and their kid wants to learn more because I think that they realize deep down that things shouldn't be this hard.
And you and I both know long term, it's the people who understand themselves, ADHD, autism, whatever.
Totally.
Or nothing at all. So people who understand themselves are the ones who seem to do very well in this world. They'll thrive. And this is just a piece of it. Going back to your processing speed example, I couldn't agree more. When we see that, if you give us a report, there's no we just start studying a day or two earlier. It just allows us, it's just a piece of information.
Right.
But I do see a lot of hesitancy in parents. They're almost scared to know sometimes. They're almost scared to be like, I don't know if I want the evaluation because I'm scared what I'll find. Do you ever get that?
All the time, especially, with the political climate, right? There, when the president announced that there was going to be a potential registry for individuals who are identified with autism, that the scare factor just goes up, right? And we know that, fear is a really big driver of changing behaviors. But I think also in that time, there were a lot of people, families who were even more committed to trying figuring out what's going on for their kiddo, right? So the fear is absolutely there. And I think it's because the stigma, there's still so much stigma around differences and brain differences. And I would say that, the fear of, I would be really careful here because I'm not, there's no right answer for any parent. It's so personal to decide, but I feel like knowledge is power. And the more we can understand the ticking, like the why or what underlying, I feel like the more we can actually then understand how to maybe change our parenting approaches or what interventions and what accommodations can be gleaned to support their kiddo. I would also say that behind every maybe struggle, there is a beautiful superpower that exists. Like I have never met one kiddo that I've assessed that doesn't have an insane ability in a different area. Right. So I think that's the other piece to remember is that with these brain differences comes these beautiful strengths. We've got creativity, logical thinking, hyper focus, stamina, enthusiasm, right? Like there's so many things that are like that double-edged sword of like, wait, but behind this struggle is really this gorgeous like shining star where we excel. And so I think that's the other piece of a comprehensive evaluation is that whether or not we identify ADHD or anxiety or autism or dyslexia, we're also highlighting the areas that this kiddo or this individual is doing so well at. And how do we promote that superpower while accommodating and recognizing that that's, the struggle is just that, is a struggle, and we can support that.
I think as humans, we tend to hyper focus on the 9th percentile for reading comprehension. We tend to just get stuck there. And there's a grieving process as a parent.
100%.
There's, when you see your kid's scores, there's a grieving process in a lot of ways. But I want to come back to what you said at the very beginning. Knowledge is power. It's just starting that process of really deeply understanding yourself is going to set everyone up for long-term success.
And I think the other piece is that the earlier that we can detect or figure these things out, the more that kiddo can be equipped to be able to ask for what they need or recognize what they need. Right? Because we don't want kiddos to be bystanders or passive in the classroom. We want them to be active learners. And so if a child knows what they need, that's the best, that you couldn't have a better recipe for success within a classroom, right? Or within a working environment. Like when you actually know what it is that makes you thrive, right? You're like a boss's dream, like just tell me what it is that you need. And I think that's the other piece is that there's no one size fits all. And I think sometimes when we don't really understand the way that the brain is actually working and processing information, we get into a cycle of, well, one size fits all. So you have ADHD, so you must need flexible seating. Mm-hmm. Or you have, anxiety, so you must need therapy with CBT or something like that. I'm throwing things out here, but that's not necessarily true. Everybody's brain is so unique and everybody's style of coping is so unique. So what works for one kiddo or one person, not necessarily going to work for the other. And when we have co-occurring conditions, we could be thinking that we're treating one thing, but we're backfiring something else, which is even harder.
We see that all the time.
Oh, tell me.
All the time. Well, meaning we think it's ADHD and we're going about it a certain way, right? And it's actually just jacking up anxiety, and we have to slow down. We have to be I don't think this is what we think it is.
Yeah.
Right? I think we're causing more anxiety, and so we have to be careful.
Well, I'm thinking too about the treatment, right? Like if you are medicated and you're medicating yourself for, you're under psychiatrist care and they're treating the ADHD, but didn't know anything about the anxiety. We could be really setting somebody up for, panic attacks here, right?
Very much, yeah.
Negative side effects because we're not really understanding what else could be going on for a kiddo.
So what is the one thing you wish parents and teachers knew about co-occurring conditions? I know that's hard because there's a lot of combinations here, But what do you wish they know?
You know the saying, like, you can't judge a book by its cover? I'm thinking about that right now because I think the piece for me is like, teachers, parents, we tend to look a lot at the external, what we see, like the behaviors, versus like what's maybe underlying and underneath and could be like masking, or the overt behaviors, external behaviors are overshadowing. And so I think for me, it's kind of like an onion, right? You got to keep peeling the layers to try and figure out like what is actually going on for this human. And though it might something might seem really, I'm going to go back to the word dramatic, but there's actually something going on underneath that we need to look at a little bit more. I have my own example. Actually, I'm parenting right now, a 4-year-old and a 7-year-old. And, the older my 7-year-old gets, the more I'm noticing that there are these characteristics that just have seemed so over the top to me, that just seem like, wow, I don't understand them. And I'm like, baffled by some of the behaviors. And so we're actually going through the assessment process right now, but as I've been able to talk to the diagnostician and the psychologist, I start to peel away and understand a little bit more that like the behaviors may seem like extreme to me, yet they're part of his experience. So, it's sensory. My kiddo is like appalled at the idea of toothpaste. And teeth brushing has always been a really hard challenge. And I know that's common. I hear that for a lot of families, that teeth brushing is common. It's a hard task. It's just so extreme to like the gagging and the right. And I have to remind myself that while this might not be my experience, this is true. Like he doesn't make himself gag, right? This is not something that he's doing on purpose.
Yeah.
And so like really reminding myself that there's something else there. Right. And so I might not know that. All I'm paying attention to is like, oh my God, we can't freaking brush our teeth. We've tried like 20 different toothpastes, right? And at this point, just brush with water, right? But the frustration, but also like underneath, right? It's got to be really hard to have to do something twice a day and feel like you're going to gag, right? And so if I can go in that way with that like compassion, it helps me so much more regulate myself as a parent, but also I would imagine that approach also feels pretty good for my kid when I can say like, I believe you. This is hard.
That is such a good example. And it's easy for us as clinicians to sit here and talk and do this and this. Everything changes when you're a parent.
Oh God, everything.
Everything changes. I have a scattered one as well. Everything changes, right? And so that is such a good example. I mean, one of the things, we talk about all the time is that your executive function skills are not your character.
Right.
Just because you're running behind doesn't make you disrespectful. Just because you don't turn something, it doesn't mean you're lazy. It means you have a lot of hard work to do on these skills, right? And that's what I hear you speaking to, right? It's like just looking a layer deeper. And again, that's hard as a teacher when you have a classroom full of kids. But there are still opportunities. When I was a teacher, I had opportunities to go on little walks and talks and talk to my kid at recess. And just even having the empathy behind it, like you said, I think is very powerful.
Yeah, I think, that relationship, right? Like, yes, a teacher myself, right? I was in a Title I school. I was 30 kids to one teacher, right? Myself. Yet I developed relationships with each one of those kids that was special and unique. That also made me so successful because any kind of behavior, any kind of difficulty, we had that trust and we had that relationship where we go back to the kids are naturally good. They want to be successful, right? And if they have a relationship, they're more likely to show up to want to be successful for that relationship, right? But it's a two-way street too, because we all go through difficult days. And if we can show up in our difficult times and still be respected and loved by the people that are around us, like our teachers, right? And understand that, we're going to have such a better working relationship, right? I mean, maybe this is tangential, but I remember like they used to put like the kids that were labeled like naughty in my classroom. And we didn't have the behaviors. I took so much time out of my, the day to develop those relationships. And I really think that it meant everything because it made my life easier.
Yeah.
5 minutes made my life so much easier.
I mean, absolutely. And what I love is we started with, here are these complex kids with ADHD and anxiety and we always come back to, what's best practice for these kids is best practice for every kid.
Totally.
Right. And I think that's the beautiful thing here is it gets overwhelming when you get a student, you see all these diagnoses, or as a parent, you get it, but
Totally.
it's the same best practice as what's best for all students.
Yeah, I'm just thinking about that too, right? Like I have one of my business partner who I like to say is my better half. We've spent so much time together, but she has always brought home the idea that, diagnosis is and a comprehensive evaluation is so important because your child is either labeling themselves or other people are labeling them in a much less helpful way, right?
Yeah,
So lazy, manipulative, can't listen, naughty, bad, right? Versus my brain is my brain is different, right? Or like this is, this part of this ADHD is why I can't do, right? I have impulse control problems. And so that's what it is. It's not that I am naughty and trying to hurt everybody, right? Like I can't stop myself versus like, why don't you just keep your hands to yourself, right? And getting that feedback over and over and over versus like, hey, you got a little impulse control difficulties. Let's figure out how to tackle that.
Yeah, absolutely. Last question I have for you, and I have to ask it because you're the only person I know who does assessments bilingually.
Oh, yes.
You are literally the only person I know who does the assessments in Spanish and English. If a family's interested in that, what should they be looking for that would be different than just a typical English evaluation?
I love that. Well, so a bilingual provider.
Oh,
yeah.
It's a good start.
I think that's really important, right? And I think also the importance and the nuance of understanding the differences in language. So if the primary language is Spanish at home and the kiddo is being educated within an academic environment that speaks English, I think it's really important to be able to identify in both languages the abilities, right? And I think that's very different and very unique. We have a lot of schools in Colorado that are actually now dual language or language immersion schools. And so people are growing up in English speaking households, but then being academically instructed in a different language. And I think, in Spanish specifically, we're going to have to measure academics in Spanish because my kiddo has literally learned to read in Spanish because they're going to Denver Language School and they are being primarily instructed in Spanish, 90% in Spanish. And a lot of his little friends who speak English at home, that's the language they're reading is Spanish. And so we need to be able to measure their academic achievement and abilities in English and in Spanish to be able to really understand what their capacity and what their potential is.
Awesome. Thank you so much for being here. And if people want to learn more about you and what you do, where can they go?
Yeah, elevatedinsights.org and can Google elevatedinsights.org. Jennifer Paz Ryan. I'm also on the board of the Autism Society of Colorado, and I know that we're a trusted partner with them as well.
Awesome. Yeah, thank you so much for all you're doing. This was very helpful.
Thank you.